This week on Healthy Living, October is Breast Cancer Awareness Month. We shed more light on the disease. And a breast cancer victim's journey on social media creates awareness and inspires many. Plus, what does excessive yawning say about your health? The answer coming up. Finally, interactive incubators in Cameroon bring new life to premature newborns. These stories and more in this edition of Healthy Living. Hello, I'm Lina Ahmedou. Thank you for joining us on Healthy Living. Get this, 2.3 million women were diagnosed with breast cancer globally in 2020, and 685,000 people died of the disease, according to the World Health Organization. More than 60% of the mortality occur in developing countries, where the majority of cases are diagnosed in late stages. Breast cancer can also affect men, but is less common. Symptoms of the disease include a lump or mass in the breast, swelling of all or part of the breast, even if no lump is felt, and irritation or dimpling of the breast. Here in the United States, Ethiopia-born California girl Malet Girma found out she had breast cancer in 2017. Since then, she had been outspoken about her condition, treatment, loss of hair, support group, and her spiritual life by vlogging her journey. Although Malet recently lost the battle to cancer weeks ago, her vlogs are creating awareness. VOA's Eden Geremu has the details.
As you see this man, you probably know the ending, you probably end what happened. And I'm not, recording this so you guys can, or anything like that. I am recording so you guys are encouraged by the journey, no matter what we go through.
This was the final message the 46-year-old Mahalet Girma sent via YouTube for her followers. It has been viewed over 500,000 times. Mahalet has been vlogging for over 4 years about her breast cancer diagnosis and treatment. Born in Ethiopia and raised in California, Mahalet came from a family of cancer fighters and survivors like her mother.
When I was pregnant with her, there was a lump in my breast, and then I had to get it out. Then, after that, I had some lumpy breasts and I had biopsies which were all negative. Till I found out in 2015 and I got treatment, and then mine was done at 2017.
The first time Mahalet found a lump in her breast and removed was when she was 17 years old. Fortunately, that lump wasn't cancerous. Since then, she and her mother had removed several lumps, prompting a request for genetic testing. And the result shows that the mother and daughter are genetically predisposed. A year later, Mahalet found out she had a breast cancer. But instead of a silent fight against the disease, she started vlogging her journey in order to create awareness about breast cancer and the treatment.
What she did with the vloggers, she wanted everything open to everyone, so that when they pass through things, so they know what to ask, what next, and things like that. And they should learn about cancer and the treatments openly. And that you can be strong mentally and you can win this. So that's what I'm sure her motto was.
Cancer survivor Mulu Burhan Girma says support plays a big role during the journey.
A strong support group is very, very important. And they have to be, as I said, they have to be really good support group. They don't have to sympathize or empathize or something. So it's better, like her friends, I remember, they will be just coming one by one every time she goes to chemo. And they bring something that she likes, and that's acceptable also.
Mahalet Girma passed away on September 7, 2021. On her last video, she recorded a message for her followers saying her journey doesn't define theirs and encourage people battling cancer and any other challenges to stay strong.
Dr. Mokhtar Touré is full professor of medical oncology at the University Félix Houphouët-Boigny Training and Research Unit in Medical Sciences, University Hospital of Treichville in Abidjan. He elaborates on breast cancer in African women.
Cancer is the disease of the cell. The mother cell can be affected by different risk factors that will attack the main characteristics of the cell, deregulates it, and makes it more immortal. As the cell becomes immortal, it spreads, destroying surrounding tissues progressively and creates metastasis, the severe form of cancer. There are factors that create hormonal imbalance in the body. Other factors that can cause hormonal imbalance are early puberty, before the age of 9, late menopause after 55, and the first full-term pregnancy over 35 years. Additionally, there is obesity and a sedentary lifestyle. Tobacco is also recognized today as a risk factor. All these factors mentioned are in about 95% of cases. The other 5% are hereditary. When you have a first-degree relative like a mother or a sister who has breast cancer, your risk is multiplied by 3. In our medical practice, daily we see Black African women with breast cancer who have had puberty at 12, menopause at 50, and given birth from the age of 18. These are risk factors that are not typical ones as described in medical literature. So, there are risk factors specific to the Black African woman that need to be analyzed in prospective study. In recent months, there has been a rising incidence of breast cancer among young women between the age of 35 and 50. What we see is that about 40 and 50% of these women have nicotine poisoning, and tobacco could play an important role. When a woman comes to see us with a lump or nodule in the breast, it could be a telltale sign. We can suspect breast cancer also in a woman with leaking blood in the nipple, a deformation of the breast, asymmetry or breasts that are uneven, and a wound at the breast that does not heal. The person may have nothing during systematic screenings. Mammography makes it possible to suspect breast cancer. A woman might have pain in the bones. In this case, the goal is to manage it and make her comfortable. So, each step has a treatment strategy. Cancer treatment is complex. There is the patient's psychological care, sharing the diagnosis, talk to the patient, talk to the parents. It's a holistic care. So, in the addition to technical care, there is a psychological care. So we bring psychologists into the treatment strategy, even spiritual and supportive care, managing pain, bone pain, psychological pain. The main prognostic factor in cancer in sub-Saharan Africa depends on poverty. Ways to lower the impact of breast cancer includes to love people, reach out and show empathy, avoid stress, do a lot of sport, eat less fat, consume fibers and vitamin-rich food, avoid animal protein as much as possible, go to the gym, laugh a lot, and avoid oxidative stress. And finally, avoid smoking.
Experts say bone marrow registries have few Black donors anywhere in the world and are non-existent in many African countries. It is a real problem that impacts the African diaspora in France, since the ethnic origin of donors and recipients must be as close as possible. We caught up with Corinne Tonnier, who is leading the fight in France to convince Afro communities to mobilize and become donors. This is a report by Elam Lecoeur in Paris. Take a look.
Corinne Tonnier is a mother who lost her 13-year-old son Ulysse to a rare blood disease 9 years ago. His only hope for a cure was a bone marrow transplant. But with so few members of France's African diaspora registering as donors, no compatible match was found. So Tonnier created an organization in Ulysse's memory and organized this football match in a Paris suburb in September to raise awareness of France's need for more ethnic African donors.
I have a second son who also has a rare blood disease that will require a bone marrow transplant. For now, he's trying to hold on. Unfortunately today, there is no suitable donor in the registry for him.
The French government's biomedicine agency says African origin donors are underrepresented not only in the French registry, but in all global registries. Only 2 African countries have bone marrow donor registries accredited by the World Donor Marrow Association, Nigeria and South Africa. Experts say it is especially hard for Black patients to find compatible donors of African origin because Africans have a greater genetic diversity than other groups like Caucasians. Françoise Audat, a French doctor specializing in blood disorders, is helping Tonier to highlight these issues.
We try to register African donors all over the world, but the proportion of Africans in some countries is not very high, so it takes a lot of volunteers to find a compatible donor. One could imagine having registries in Africa with more donors to provide bone marrow to compatriots in diaspora communities around the world. But the problem is political instability, which makes communication difficult.
Without more African donors, a patient has only a small chance of finding a match. The French Biomedicine Agency says the likelihood of any individual patient being compatible with a bone marrow donor chosen randomly from the world's registries is just 1 in 1 million.
Yawning. We all do it and we can't help it. Experts say the causes of yawning include sleepiness or drowsiness, boredom, regulating brain temperature as it might help cool down your overheating brain. The American Sleep Foundation notes that human beings yawn 5 to 10 times a day on average. However, some people experience excessive yawning and tend to yawn more frequently, sometimes even up to 100 times a day, which can be abnormal. Should you be concerned if you have excessive yawning? Well, according to the U.S. National Library of Medicine, excessive yawning is due to, among other things, drowsiness or excessive sleepiness, side effects of medication, neurological disorders such as stroke, epilepsy, multiple sclerosis, and head trauma. Experts say treating excessive yawning is achieved by treating the underlying cause. If you feel that you're experiencing excessive yawning, they recommend you keep track of other symptoms and talk to your doctor. In Cameroon, the neonatal mortality rate has reached 28 deaths per 1,000 births. To overcome this problem, a team of engineers has developed for 3 years an interactive incubator that allows parents and doctors to constantly monitor the health of premature newborns. Chirikaore has the detail.
In this hospital, premature babies, sometimes weighing less than 2 kilograms, are placed in incubators that are made in Cameroon. Equipped with cameras, these incubators transmit in real time all the vital signs of premature babies to health personnel and parents. They use rechargeable solar batteries, making it possible to cope with frequent power outages.
This incubator has various benefits because we can monitor the babies from a distance. With the prevention of infections and the coming and going of people in the room, since the mother doesn't always have access to the room, being at home or outside, she can monitor her baby and the movements of her baby.
After about 2 weeks in this hospital, Isabel Toomey's premature baby is already doing better.
When I gave birth, he weighed less than 2 kilos. I was referred to this place, and now he's already at a healthy weight. The color of his skin improved too. He is more of a healthy pink color and he's crying normally. For me, it has been beneficial.
The University Agency for Innovation, at the origin of this initiative, has already sold 18 incubators to public and private hospitals in the country. The cost is about 2 million CFA francs per unit, so buyers have the option of paying in installments.
First, it works like a normal incubator, meaning premature babies are in a soundproof space. There are ideal thermal conditions for the baby's development, and it's all done through electrical regulation. In our particular context, in addition to the global context, and this particular resilience to energy issues, we wanted to ensure an interactivity and allow monitoring from a distance, as well as close monitoring.
The University Agency for Innovation says it's working with the Cameroon's health ministry to equip hospitals with 1,000 incubators over the next 4 years.
For the latest news and coverage on the coronavirus, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linahmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.